SAMRI acknowledges the Kaurna people as the traditional custodians of the Adelaide region, where our buildings are located. We recognise the Kaurna people's cultural, spiritual, physical and emotional connection with their land. We honour and pay our respects to the Kaurna elders, both past and present, and all generations of Kaurna people, now and into the future. We acknowledge all other traditional owners who live across South Australia, with a special thanks to those whose lands we visited in the production of these videos. This video has been made for general information only and should not replace medical or professional advice. Speak to your health practitioner if you have any questions related to your health or medical condition. The South Australian Aboriginal Chronic Disease Consortium does not specifically endorse any medicines or treatments described in this video. Aboriginal and Torres Strait Islander viewers are warned that the following video contains sensitive material and may contain images and voices of deceased persons.
Now, diabetes is a condition that can affect virtually any system of the body. We know that it's associated with increased rates of developing end-stage kidney disease or kidney failure. We know diabetes is associated with much higher rates of people developing heart attacks and strokes. We know that diabetes, and particularly high levels of sugar in your blood over a long period of time, can be associated with damage on the back of your eye. We also know that people with diabetes are much more likely to have problems with their feet, to develop ulcers, to have poor circulation, and therefore be much more likely to require amputations, particularly if infections or gangrene settles in. So we worry about these complications a lot.
Chronic disease diabetes it's not something that hits you the next day once you've been told, it's something that gradually comes on, and it's the complications that really impact.
When I started to see them in cousins my own age and, family members lose lives and lose, limbs and that all through to complications, and you don't there's nothing like seeing someone that you love and care about in a really bad place because of their complications of diabetes.
As you have just heard, diabetes-related complications can include damage to the large blood vessels, leading to heart attack, stroke, or circulation problems in your lower legs. It can also damage small blood vessels, which causes problems in the eyes, kidneys, feet, and nerves. Lastly, it can affect other parts of the body, including the skin, teeth, and gums.
I had a heart attack and I woke up a week later in the Queen Elizabeth Hospital. I didn't know where I was, in the ICU. And that scared me because I didn't know where I was and what happened in between.
Yeah, about 5 years ago I had a quadruple bypass, which I think part of my diabetes was sort of part of that. Thought I was just being, like the diabetes was part of me feeling the way I was, feeling lethargic and unhealthy, having these angina pains, and without doing nothing about it. So I went and seen the doctor. He gave me a stress test. They found some blockages in my heart. But the thing about it, I never had a heart attack. I just realised from the angina pains that were having, there was something was going on with me. So the doctor sent me away to Adelaide to have angiogram, and everything led from there because I found some blockages in my heart.
It is important, as Lincoln said, to tell your healthcare team or doctor about any pains or issues you may have in relation to your heart. If you think you are having a heart attack or a stroke, call an ambulance straight away. It could save your life or the life of a loved one. Talk to your health professional about what signs and symptoms you should look out for. Prevention and early detection is key. Regular monitoring and care from your healthcare team will help you to keep your blood vessels and heart healthy and prevent or delay further damage. Some people with diabetes do not get symptoms, which means you may have problems with your heart or blood vessels and not even know it. It is very important to have your blood pressure measured and a blood test to check your blood fats or cholesterol regularly. You might need some medicines to help keep your blood pressure and cholesterol in the healthy range. Eating healthy, being active, aiming for a healthy weight, and not smoking are also very important. Talk to your health worker, diabetes educator, dietitian, or GP about what you can do to look after your heart health.
Diabetes can also affect the kidneys as well, and cause you to have problems with getting rid of water and other chemicals from your body.
High blood pressure and high blood glucose can damage the small blood vessels in your kidneys. You won't know if your kidneys are in trouble until the damage is done. This is why it is really important to have your regular blood and urine tests. Early detection and treatment of kidney problems will give you the best chance of keeping your kidneys healthy. Some people with kidney damage need to have dialysis, and this can be done at a hospital, clinic, or at home. Dialysis is a treatment for kidney failure that rids your body of unwanted toxins, waste products, and excess fluids by filtering your blood. Jennifer and Daryl talk about their experience with kidney damage and dialysis.
And my kidney not working, I'm on dialysis now. It's boring. You sit on the chair. From in Whyalla, I go back to the dialysis at 3 o'clock. And then I come off at 9 o'clock. Monday, Wednesday, Friday.
Diagnosed nearly 10 years ago now, yeah. And yeah, it's gotten worse over the years. Now I'm on peritoneal dialysis, which I do every night, 8 hours every night, 7 days a week. Made it better, compared to how I was a couple of years ago. Wasn't feeling too good. Yes, I feel a lot better. Now I'm on the donor list, so something to look forward to. And I still work, so it doesn't stop me from working, which I'm happy about. Because I thought I might have to do the fistula when we sit on the chair. Well, I didn't really want to do that, so that would definitely impact on me for my life. So I chose peritoneal dialysis. So, I was happy I'd done that.
We have heard throughout this video that diabetes can lead to amputation. The good news is that 80% of amputations related to diabetes can be prevented. Dr. Sarah Jones explains what can happen to the feet when you have diabetes.
There are two main problems that we see occurring in people with diabetes that affect the foot. The first of these is something called sensory neuropathy, and the second one is something called peripheral vascular disease. Now, in sensory neuropathy, people lose their sense of feeling. This means that they can lose their feeling of pain, of pressure, of heat, of cold, or of what we call joint position, which is knowing where your foot is when it hits the ground and how hard it hits the ground. And losing those sorts of sensations takes away every bit of protection that you have to know what your foot is doing, or if something is going to be rubbing or is going to hurt it. The other complication that we see is, as I said before, peripheral vascular disease. Now, peripheral vascular disease affects the blood vessels in the feet and in the legs. And over a period of time, the blood vessels can narrow down, so there's less blood getting to the skin and to the muscles of the feet and the legs to keep them healthy. Now, that becomes a problem because if you do hurt yourself, if you get a cut or a sore or an ulcer on your foot or on your leg, it can take a lot longer to heal because there's not blood flow getting down there to help things to heal.
It's really important that people with diabetes, as well as having their sugars monitored and their diabetes well controlled, look after their feet really well, because if you get damage to the foot and then an infection in the foot, you can get into all sorts of trouble and often need to go into hospital or something like that. We have lots of people in different fields of expertise that help out with diabetic foot problems, and what we really want to avoid is the infection getting to the point where you could lose a toe or even lose the leg, and that's a very common occurrence, and really we should be able to avoid it most of the time with good care. So one of the worst things that can happen with diabetic foot problems is to end up needing surgery to the foot and losing a toe or even losing the leg. Obviously that's a terrible thing to happen, and rehabilitation after that's quite difficult if you have an amputation below or above the knee.
Yeah, when I first got diagnosed with diabetes, I was afraid because I knew that diabetes could kill you, because I've seen it with like other people, you know, they get their legs cut off. As soon as they get their leg cut off, they don't last long. So I make sure I wear my shoes, I look after my feet, my body, you know.
There are lots of things you can do to prevent foot problems. 1. Make sure you ask your healthcare team about checking your feet regularly. Your foot check can be done by the GP, diabetes educator, podiatrist, nurse, or Aboriginal health worker. There are ways you can check your own feet too. Talk to your health team about what things you can do to check and look after your feet.
How do you look after your feet, and what do you need to do to make sure that they stay healthy? Well, there's a number of different things, and probably the most important thing that every person should be doing with their feet is making sure that they check their feet every day. When you're checking your feet, you're looking for signs of any cuts, of any redness, of any swelling, basically of anything that wasn't there the day before. If you are concerned, you should go and see the local Aboriginal health worker or nurse or doctor or podiatrist and get them to check out what's going on with your foot. Don't leave any foot problems to get better by themselves or to go away. They may not go away. Your foot may go away instead, and that's something we want to avoid.
Everyone living with diabetes is at risk of developing blindness because of diabetes. The way the diabetes causes blindness is that it damages the small blood vessels at the back of the eye. But not only that, it can also cause other problems with your vision, such as blurred vision, so you may need glasses, or it can bring on cataract, which is the cloudiness of the lens, to come on earlier and more severe. Almost all cases of diabetes blindness can be avoided. This is through early detection, timely treatment, and optimum diabetes management.
I had blood in my eyes and had to have two operations on my right eye and laser treatment on my left. Yeah, so yeah. But my left eye is better than my right now.
I got diabetes 4 years ago. And one side of my eye is blind, but I can see a little bit on this side, on the left.
When I first told that I may have diabetes, I felt a bit frightened because it runs in my family, and I've had a family member who's actually lost their eyesight.
As we have just heard, serious vision loss can occur when you have diabetes. Often, there are no obvious signs or symptoms until the problem is advanced. Having regular eye checks with your optometrist or ophthalmologist is the only way to make sure your eyes are okay. As highlighted by Jose, almost all cases of diabetes blindness can be avoided. This is through early detection, timely treatment, and optimum diabetes management.
We know that people with diabetes are much more likely to have trouble with their sleep, particularly at night. Obstructive sleep apnea is more common in people who have diabetes than those who do not. We know that people with diabetes are much more likely to suffer from depression and other issues of social emotional well-being. And we know that people who have diabetes are more prone to infections, whether that's on the skin or whether it's inside their body, in their blood. They're more likely to get pneumonia and chest infections. And these are all the things as doctors we worry about all of the time with our patients. And that's why we're constantly trying to work out how to reduce people's blood sugar levels. It's because of these complications.
Now fortunately, the complications don't occur for everyone, and we know that there's good evidence that if you control your blood glucose levels well, it's much less likely to occur as well.
Self-management of chronic conditions and self-management of diabetes, that you are the driver of your healthcare, but it's also important that you are linked in with other health specialists who can support you with your journey. We can link people up with diabetes educators, Aboriginal health workers, GPs, diabetes specialists, dietitians, you name it. We can link people in to provide a very comprehensive team around you so that you can manage your diabetes to the best that you can, so that you don't end up with those long-term complications that can impact on your life.
We hope this video has helped you understand diabetes complications and what you can do to prevent them from happening or to slow down the progression. In summary, your healthcare team will regularly review the following parts of your diabetes care: blood glucose levels, or HbA1c, blood pressure, foot assessment, eye examination, kidney health, blood fats or cholesterol, weight, healthy eating, physical activity, medication review, smoking, diabetes management, and emotional health. For further information and resources, check out the links on your screen now. The South Australian Aboriginal Chronic Disease Consortium would like to thank the following Aboriginal community members and health professionals who participated in this video. This suite of diabetes video resources has been made possible by funding from Country SA PHN.